Hi, today's October 8th, and it's day 8 of Tips for a Healthy Pelvic Floor. My mission is to offer you tips and strategies that are safe for your body and your pelvic floor. Everybody and every body is special and unique, and the tips that I may offer you may not be appropriate for your individual needs. So talk to your healthcare provider if you have any kind of concerns about your ability or readiness to adopt the tips and strategies and exercises. What I have to offer is not a substitute for professional medical diagnosis, treatment, or advice. So if you choose to take on the strategies and tips and exercises that I have to offer, you're doing it at your own risk. That said, we are at week 2, tip number 8. Last week, I introduced you to the fact that pelvic floor issues do exist and that there are options other than giving up and wearing diapers or putting up with the pain. I had you watch 2 great videos describing the anatomy of your pelvic floor. You got to see your pelvic diaphragm and your deep perineal pouch. I chatted about the relationship about the breathing muscle called the diaphragm and your pelvic floor, and how we want to ensure that the diaphragm is unrestricted so that your pelvic floor can be unrestricted and has a healthy mobility. I encourage you to take on a breathing exercise, a mindful breathing exercise, by sitting on a soft surface and observing the subtle movements, the expansion and the retraction of the pelvic floor. I recommend you continue this on a daily basis. This exercise is crucial for everything else that we're going to be working on in the weeks to come. I also chatted about how we want to track down any kind of restrictions that could negatively affect our breath. Things like a tight rib cage. And the exercise that I suggested that you do is the thoracic breath, is breathing fully into the ribs, moving your ribs as much as possible. And I called it, some people call it a 360-degree breath, thinking I want to feel every part of my lungs, have every part of my ribs move, front, back, side, top, bottom. Just move them greatly. Practice that daily after your mindful breath exercise. So we also want to make sure that there's no unwanted increase in abdominal pressure. And the things I kind of mentioned to watch out for is don't pull in your belly button before you brace for any kind of core or demanding movement. Don't hold your breath during exertion, and don't wear tight restrictive pants. Maybe you thought that was just a joke for Thanksgiving, but no, actually don't wear restrictive pants. It increases abdominal pressure. So this week, I'm going to start to give you some lifestyle tips that I'm going to ask you to focus on, and keeping the principles we learned last week in the forefront of your mind as you do it. It could be very well that changing some of the lifestyle habits that I'm going to suggest might make all the difference for you, and really quickly. But for some of you, it's going to take a whole lot more. But I can guarantee you that if you don't do the exercises I taught you last week, and I just went over right now, and you don't implement the lifestyle changes, the next phases aren't going to be very effective for you, and you're always going to be struggling. So it's worth doing the basics, taking our time to go over them, and you'll see a difference. Okay, so what I'm going to suggest to you today is you're going to watch a really cute video, and you might have seen it already. It is the unicorn pooping. It actually promotes the squatty potty and teaches you how your alignment when you're voiding will make a difference. So the tips this week are going to have to do with bathroom habits. I'm going to talk about those all week. The best way to start is watch the video. It's cute. Again, if you're not interested in buying a squatty potty, blocks are great, or anything that will position you properly as explained in that video. So enjoy watching it, and we will talk more tomorrow. Have a great day.